Hi, I'm Ashleigh Fletcher. I'm a healthcare assistant at Pickering Medical practice.
Patients with dementia.
Generally, they've always had a conversation with a doctor, so it's normally that they're coming for the GP cog memory and the bloods. Sometimes, if that's not the case, and they're in and they're showing signs of forgetfulness, or they question you, or I forget this, it's generally just normal to just ask the general questions and do the bloods and let the doctor know that this is what's going on. I generally just be asking general questions to them. You know, have you noticed that your memory's been getting any worse? Do you forget things that's recently happened? Do you remember conversations? Just pulling that little bit of information. Sometimes I'll say, yeah, okay, is it okay to ask some questions? Yeah, that's fine. While I'm here, I might as well answer instead of coming back. So we go through and then I mention it and I say, I will pass this information on to the doctor. We use a tool called GP Cog, and it's a link that we click on for it via EMIS, and we pop it on there, a couple of questions. At the beginning we sort of say, we're going to give you a name and address, and then you get them to repeat it back to you, and then you ask them a couple more questions, the date, draw a clock, and they then have to repeat the address. And then sometimes if that triggers that they can't remember that, you have to go on to further more questions, and that only really happens if we've got somebody else in the room with them. Because obviously then they can sort of like relate and say yes or no, and then we save that into the system.
Does that matter to you?
It matters because we care. I'm in this job because I care about individuals. Not only that, you get to see the care going through from day dot that you see them to whenever that care stops, you know, and they need the best possible care. A, to keep them at home, B, to build that trust up and rapport so that they know that they can always come back to us as a surgery and that they rely on us. There's so many things out there that a population don't know about, and we can guide them towards anything they want really. And some people are actually based in the surgery, which can help there and then just by having a general conversation with them. I like the fact that you get to see them along the progress, and they're actually quite thankful at the end of it when everything's sorted. I think they're happy because it saves an appointment coming back. It saves an extra step of actually to contact the patient individually, whereas actually they're in there, so it saves a lot more work. And I like doing it because it helps, and that person may need that help.